was hoping to meet with the Finnick family and personally express my sorrow for their loss before today, but because of scheduling conflicts, I've not been able to meet with them. I very much hope to have that opportunity to speak with the family soon. As a father myself, I cannot begin to imagine the depth of their loss and sorrow. We have been continuously keeping them informed on the investigation. As sheriff, I accept full responsibility. I promise the Finnick family a thorough and transparent investigation. The Finnick family and the citizens of Flagler County deserve answers, and the citizens will get them. I intend to get the answers and find out what happened. We will leave no stone unturned. The system failed Anthony. I, as your sheriff, and this agency, along with our medical providers, will work hard to prevent another tragedy from occurring. Several investigations are still underway, so we don't have all the facts yet. But I can share what actions I am taking now based on what we know so far. The medical examiner will not have the actual cause of death for another 60 to 90 days. We are interviewing all possible witnesses, such as sheriff's personnel and inmates, paramedics, reviewing all medical documents, and analyzing every possible source of evidence, such as phone calls and CCTV recordings. The investigations are ongoing and will not be done for some time. You may recall that when this incident first occurred, I asked for the Florida Department of Law Enforcement to conduct the investigation, and they declined. As such, our agency is investigating it, but again, it will be 100% transparent, and we will leave no stone unturned. It is important to know the recent history of the Flagler County Inmate Detention Facility. In 2017, I took office and inherited a jail that needed significant improvement. I put in new leadership, new policies, and updated technology. We're still making changes. As a result of our changes, in late 2018, the jail was awarded state accreditation by the Florida Commission on Corrections Accreditation for the first time in its 100-year history. This is a very rigorous process, and only 34 jails in Florida hold this distinction. There are only 2 jails in the 7th Judicial Circuit that are accredited. Our jail, and the St. Johns County Sheriff's Jail. State inspectors reviewed all of our policies and procedures and confirmed that our jail adheres to the best correctional practices, and that's why they awarded us accreditation. While the jail medical program was fully compliant with minimal standards when I became sheriff, I felt it could be better. When I became sheriff, the jail was using part-time paramedics, handing out medication, a doctor who only visited once a week, and sworn correctional deputies were trying to address inmate health issues since medical services were only part-time. These deputies were not trained in medical services. The jail lacked 24-hour on-site medical services. The jail had an EKG machine, for example, that was not being used because no one was trained on it. Deputies were asking medical questions during intake instead of a new arrestee being given a medical exam by a trained individual. Deputies were providing insulin to diabetic inmates. The medical wing of the new expanded jail, which was built before I was sheriff, was value engineered out of expansion by the former sheriff and former county administrator to save money, leaving us with only 2 medical cells in the facility, a facility that can hold up to 403 inmates. Frankly, the jail, when I became sheriff, did not have the medical services and healthcare staffing I felt was needed. We did a lot of research. We surveyed every sheriff's office in Florida to identify best practices in inmate healthcare. The clear consensus among Florida sheriffs is you want to have a quality medical provider delivering 24-hour on-site coverage. 25 sheriffs were using contracted services. Some of the other sheriffs either had in-house because they're a very large facility, or some of the facilities had no medical services at all. Of those 25 sheriffs that were using contracted services, 19 were using Armor Correctional Health Care. The selection of our contracted healthcare provider was a competitive bid process. Only 2 companies bid. Armor had the best proposal, offering 24-hour on-site medical services using an enhanced level of staff. And by the way, Armor was not the cheapest of the 2 proposals. In February 2018, Armor was contracted to be our medical service provider. Again, 19 other sheriffs, including Volusia County and St. Johns County, were using them and recommended them based on their experience. Since Armor was serving Volusia and St. Johns County, there was already a workforce in place to meet our need. Armor performed well for the most part of 2018. They provided better staffing and services than we had before. They evaluated every new arrestee for medical and mental health issues, but they faltered. I also understand they had a recent change in corporate leadership and ownership, resulting in many of the top leaders leaving. After reviewing the evidence available to me at this point, I am not satisfied with how Armor acted and how they have responded to this tragedy. I expect our contractors to be partners. In response to this tragedy, Armor has shown little interest in anything other than denying responsibility and trying to bill us for even more money. When we hired them, they promised to be a full partner and provide the care and services I expected. Always be responsive and effectively address any problems. I don't believe they have kept their promise to the sheriff's office or to our inmates. As a result, today I directed my general counsel to notify Armor that I am terminating their contract. The contract requires a 90-day notice. I also directed staff to immediately issue an RFP to identify and select a new medical services provider. We can do better, and we will do better. I'm not going back to the old system that was in place when I became sheriff, using part-time paramedics, handing out medication, and detention deputies untrained in inmate medical services being used to address inmate health issues. We made the right decision to go to 24-hour on-site medical services. There are several nationally known correctional healthcare service providers who successfully provide medical care at correctional institutions throughout America. We will scrutinize their proposals, ask all the right questions, and select the one which is best for our inmates and taxpayers. We will also be making the following changes at the jail, along with bringing in a new medical services provider. Today, these changes will strengthen inmate health care, enhance our quality of care, and ensure effective and continuous communication with families of inmates who have medical concerns. All jail supervisors and jail administrators will always be immediately notified of any and all inmate medical concerns. This will allow immediate oversight of any medical condition or concerns that may require immediate attention. During the booking medical screening process, inmates will be offered a medical release form they can complete, allowing medical information to be shared with authorized family or friends. This enables us to communicate fully with family members, given the very strict federal law governing patient medical privacy. Signage is being added to each housing unit in the inmate handbook, encouraging inmates to report medical or other concerns to jail personnel for themselves or other inmates that they may be concerned about. To assist family members, we have added a dedicated jail medical page to the Sheriff's Office website. providing information and direct contact numbers to include the inmate medical section, inmate services director, and division chief. We've added a hotline phone number for inmate medical concerns that families can call and report immediately to the jail. We have reevaluated the medical fee schedule. Just like you with your HMO, there's a copay. So I reevaluated the medical fee schedule, and I've directed that medical services offered with no copay for follow-up care, mental health services, or for an inmate or staff referral to medical. If an inmate is transported to the hospital for a critical emergency, the family or listed emergency contact person will be immediately notified. Now let me explain to you why we're doing that for a critical emergency. Anytime an inmate that is in our custody is transported off the campus, there is the potential for a planned escape. So generally, we don't want to tell everybody that this inmate's going X, Y, and Z. But if they leave our facility in a critical emergency, the family will be notified immediately. We will release the results of all investigations when they are complete. We're going to continue to be honest, open, and transparent because that's the way we do the public business here. We will always answer every question. When there's a problem, when someone or something falls short of our standards, we will deal with it. I've heard a few say they are just inmates. I disagree. They are human beings. Anthony Finnick was a son, a brother, and a father. He was well behaved in our custody. He was trying to make positive changes in his life, despite past struggles and mistakes. Our real goal is to stop the cycle of crime and addiction, which is why we have significantly increased the quantity and quality of programs at the jail aimed at ending substance abuse and guiding inmates towards educational and employment opportunities. I'm the sheriff. I have a legal and moral responsibility for the care of people who are in our custody. If I had a family member in this jail, I would want them to be treated fairly and appropriately and their medical needs met. That is what I expect. I expect that from our staff. I expect it from our contractors. To the Finnick family, I'm very sorry. I can't bring Anthony back, but I can work to prevent another family from ever experiencing the loss of a loved one in our custody. The changes I am making are important and significant and consistent with my ongoing efforts to continually improve and make your sheriff's office the best it can be. I'll be glad to answer any questions that they may have.